Very good morning, everybody. A very good Saturday. As you can see behind Sharmagaru, we can see the temple there, the idols. So why don't we'll start with a little prayer. Sharmagaru, can we do the typical temple honors and then we'll get started with the webinar.
Om Gum Gurave Namaha Vakratunda Mahakaya Koti Surya Samaprabha Nirvighnam Kuru Me Deva Sarvakaryeshu Sarvada Om Asatoma Sadgamaya Tamasoma Jyotirgamaya Mrityorma Amrutangamaya Om Shanti 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 Om Hrim Ram Ram Vishnu Shaktaye Namaha Om Namo Bhagavati Vishnu Shakti Menam Om Hara Hara Naya Naya Pacha Pacha Madha Madha Utsadaya Dure Kuru Swaha Himavantang Gacha Jiva Saha 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 Chandra Mandala Gatosi Swaha Om. Thank you.
Namaste, Sharmagaru. Again, thank you very much. Again, welcome to everyone. We are indeed honored and delighted that we have Dr. Ravi Chanchala again with us. Again, as you all know, this is part of the Temple Expert Series that we've been doing a series of webinars. And Dr. Ravi Janjala, as you all know, I mean, we all know him so much, so I want to really skip doing introductions. But I think the one thing that really always connects me is he really cares a lot about our well-being, our health, and good being. And so he's pretty modest. Ravi wants to say, I'm not necessarily the expert on the COVID, but as you know, like as a person who cares about all of us, he collects a lot of research. So we invited Ravi to come back and tell us. And I'll tell you what actually motivated me and actually inspiring me to have Dr. Janjala back. You probably every one of us have been hearing there's a massive surge. There's been a huge talk about shutdown, sort of, in Bay Area, and there's been a talk about the same thing in LA. As a matter of fact, today, this morning, London is announcing there is another strain that is coming, and there's another surge that's coming. So London may have a massive shutdown. Again, it's kind of confusing. And in parallel, there's a vaccine that's been announced, and Ravi actually did get the vaccine, I guess, as of yesterday or so. So we thought this would be a great forum for us to quickly kind of exchange notes and take suggestions and hear the expertise from Dr. Ravi Janjala. So this way we'll do. I will ask some standard questions. It'll be like 5 or 6 questions. What I want to request every one of you in the Q&A window, if you can put in the questions that you want to ask, I will moderate and I will actually ask Ravi. So that's how we'll do the format. So hopefully first 15 to 20 minutes is a structured Q&A, and beyond that, you can ask questions and Ravi will share. As usual, Ravi always comes with his whole research deck. He has got a huge deck, but he will pick and choose what is the right one to go. So with that background, Ravi, I want to just go back to the same thing. Why is this third surge? I mean, there's so much talk that's going on. What's this all about, this new surge?
Oh, so Ravi, if I could share my screen, I think pictures are better than 1,000 words, but it is real. It is a serious situation. We are in California, especially, we are having a tremendous surge. And some of the slides will show you the numbers. And the intent is, I'm not an expert. I'm not somebody in the front line, but I'm in the committees that listen to the town hall meetings in our organization. So I just hopefully by this, we all realize this is not something to take lightly. But I'm very happy that there seems to be light at the end of the tunnel, or as some experts have said, this is the beginning of the end. The The vaccine is very much here. It is very effective. I thought, Ravi, if I could talk about the numbers of the surge, just to, I don't want to put fear. I just want to put respect to this virus.
Please.
Can you see the slides, Ravi?
Yes, we can see that.
These insights are evolving, and they can change, so rapidly. So initially, the masking was not uh, very strictly recommended, and there was no uniform messaging in this country. The scientists have been sidelined. So we lost a lot of good opportunities, and we learned a lot, and we are still learning about this. As you can see, we did the first talk, Ravi. You wanted me to just share with our community because there's so much going on. And with this WhatsApp, it's just at a push of a button. A lot of false narratives have also been sent, or out of fear, or people are, I think before we push it to a lot of people, I think it's better to verify if it's accurate or not with somebody who's a content expert before sharing it to a lot of people. I think we all need to develop some etiquette in this WhatsApp.
Totally.
So Ravi, this is a slide that I showed you in April. And then in July, I didn't show it because we wanted to keep it very short. And that's my intent today as well. So the Spanish flu 100 years ago killed about 40 million people. Even though we have a lot more population in the world, the mortality so far is 1.65 million people as of today. So it is just such an unfortunate thing that has devastated our economy, devastated us meeting each other. We should have probably called it physical distancing than social distancing. People are not even making phone calls. Most of my friends are not even calling me. If you can notice, Spanish flu killed that many people, and we are here. This is a slide I showed in July. 234,000 died worldwide at that time, and now the worldwide death rate is 1.65 million. So see how fast the death rate has increased. It's because of more number of people getting exposed to this. Knowing a lot about what it takes to prevent, we as a population of this world, due to various things that we have to make a livelihood, we have to go out, we have to take care of things, we are not able to have a good control of this until now. So this is the latest one as of December 18th. And you can see we went through the first surge in the US. And after we thought we had a good handle it's plateauing, it's coming down. With the Memorial Day weekend, and few weeks later, you start seeing the second surge, and then it persisted because of the July 4th. Then we thought, okay, we got scared, we are doing better. And some of the other states, which are the red states, maybe started encouraging masks and believe that this is real. However, with the Labor Day weekend and then Thanksgiving, we are here and we are still increasing. As of yesterday, we have almost 250,000 new cases in this country. So this is the third surge for us in the US. And California, where we were the leaders, we had the first stay at home way back on March 9th, if I'm not mistaken.
Yes.
And now we are at the most number of cases. We are a bigger population. So it's very difficult to keep the society locked down. That's not the word we should be using. We should use common sense, wearing the mask and making social distancing. And this is a death rate, and this is daily death rate. So you can see it is slowly creeping up, and never before we had these kind of death rates of 3,000, 2,000 a day. And this is where we are. This is a surge, Ravi.
Yeah, that's concerning, Ravi, for sure. Actually, the graph actually helps explain a lot more. But having said this, can I ask you a quick question, Ravi?
Yes, Ravi.
Even though we see this, I hear, and as to rightfully what you said in this WhatsApp chats, whatnot, many people seem to belittle this and saying, comparing this with the malaria deaths, or road accidents, or HIV, or alcohol, or smoking related deaths, they say, hey, that's much higher than the number that this coronavirus is taking. Where is that we're all missing the point? I mean, the numbers they're saying, it's somewhat similar. Why are we so scared? Why are we so concerned?
So if we can pinpoint who is going to actually get very sick, if we can identify the group who's actually going to get very sick and who's likely to die, we can say, why don't you guys be careful? Rest of us can keep going, get exposed, get this herd immunity, like some of the red states were or some of the advisors to the still president have said, or Sweden has done, is to get herd immunity. We're going to get it anyways, and it's not really lethal for most of us. So the problem is, Ravi, my close friend and classmate who's apparently healthy, he's younger than me, he passed away. He battled coronavirus uh, for several weeks and he succumbed to it. And it's so unfortunate. And it is beginning to hit home. I have another friend who may not make it. And there are many others who are not close friends, but friends of friends. So this is real, Ravi. The thing is, we don't know who will get to be so sick that they'll be admitted. Yes, granted, only 10 to 15% of us get sick enough to be needing admissions. And so this data I'll show you, Ravi. When we did the first presentation in April 30th, we had in our group, we have 3 million patients and about 55,000 were tested at the time. Mm-hmm. And the mortality, only 200 people among our 3 million patients died. Then we did an update July 2nd. At that time, it jumped up to 265,000 tested and mortality went up to 503.
Right.
The mortality appeared to be about 1.5%. Granted, many were not getting the tests because they were very limited. Only people that had symptoms got tests. Now, as of today, we have 15 hospitals. Our patient population is 3 million. These are all insured patients. And we are only testing people to a large extent who are category 3 and 4, that is, they have symptoms or when they get admitted or prior to any procedures. We tested 1.3 million patients in our organization. No, 1.3 million tests, not patients. Right. Some patients could have gotten 4 or 5. Right. And we have had 230,000 positive patients. Wow. And our mortality is 2,000 people died. It could be a little more, but this is what we think. And if you look at among all the people tested, the mortality is about 0.9. So should we shut down the economy? Should we all stay home and fear of this? I'm not sure that is necessary. It's just been that's been by Dr. Fauci, Dr. Sanjay Gupta, many other experts, CDC, and worldwide experts are saying is distance, have the rooms ventilated, wear the mask, wash hands, things like that we need to do. But when we talked about vaccines at this time, yes. So these were the admissions that time, Ravi, but now, as of now, we have 15,000 patients in the hospitals, in our 15 hospitals. As wow. of, we have admitted 15,000 patients since March, okay? And right now we have 1,700 patients in the hospital. 342 end up in the ICU.
Wow.
So we are talking about what, Ravi?
About 20%,
20%. It used to be almost 40%, but now we have better learned how to manage this disease with prone positioning, high flow oxygen, things like that. And on the ventilator, about 306. So the average length of stay of the patients who are hospitalized is about 4 days. Average length of stay, LOS is length of stay, in the ICU is about 7 days. Wow. So 85% of the infected patients do not require hospitalization. 15% usually require. This is a, give or take, and 5% can get really sick. Among those hospitalized, 87% live, even those among hospitalized. So we know the mortality is less than 1%. Among those end up on ventilator, not everybody dies, 60% live. So what it is, Ravi, is when we go to war, this is a war, we are fighting with that little guy. Mm-hmm. There will be people who die, but there are a lot of people injured. So who are those that are going to be injured? Some people are left with scarred lungs. Some people are left with loss of taste and smell, even for long term. Some are even short of breath months later. Some have some, memory loss. Some have some kidney damage. Some have heart inflammation and, heart damage. So kidney damage. So this can affect even people who are apparently healthy. So that is the reason we need to take precautions. Mainly we are taking precautions so we don't infect the vulnerable. And right now the importance to take the precaution is the hospitals are full. We can't afford anyone to get sick because there's no room in the hospital. And now we are thinking of having this independent group to decide if there are only 100 ventilators. So for instance, Kaiser Irvine, a hospital like that, will have 50, 60 ventilators. So what if 80 people need it? Who is the one going to pick and choose, right? These are hard decisions to make. So they want to take it away from the physician so that it is made independently, it is made kindly, it is made, in a fair manner without race, age, sex, and things like that.
Yeah. Ravi, can I, no, this is very useful. So one question I want to ask you is, there's been this whole speak about vaccine. And of course, the first vaccine has come. I think, if I'm right, yesterday I heard the second one potentially is also coming any minute. But I know you yourself got the vaccine shot yesterday. And there's been a whole discussion about, is vaccine effective? What's the efficacy of it? Do we want to believe in it? What are the side effects? Can you please expand on the vaccine? And I think the most important, honestly, I know you are the healthcare worker, therefore you were first in the line. What about the all of us? When are we likely to get? What's the weight? What should we take? I know a lot of questions, but if you can touch upon it, I can. Thank you.
I really didn't expect the vaccine to be here this year. I thought it'll take a year. The earliest the human was able to make the vaccine in the shortest time was 5 years.
Mm-hmm.
But everybody thinks it was rushed, or some people think it was rushed. It was not rushed because we had made ground in the last decade how to make such a vaccine. The Donald Trump actually abandoned the pandemic task force 2 years ago. He stopped funding it. We could have been even faster if we did testing sooner, if we spent more money on testing, spend more money on PPEs, give a uniform message across the country about wearing masks and the distancing. Having said that, one of the good things he did was he didn't interfere with vaccine production. In fact, the Operation Warp Speed is under his administration, and they did a terrific job. What they did was they took $7.2 billion and gave it to 4 companies: Pfizer, Moderna, AstraZeneca, and Novavax. 7.27 billion. We could have had vaccines sooner, but it doesn't make money for the company. So once this was done, we have now 2 vaccines which are FDA approved. One is the vaccine, both are made of mRNA. So these don't have any virus. So what they do is they take a part of the virus called, these are RNA viruses. They take a part of the virus and they manufacture it and inject it. So it's not the virus, it's just mRNA. And what it does is it produces spike protein within our body, not the whole virus. And that spike protein generates antibodies. So the antibodies will fight against the virus causing harm within us. So it is very effective. They tested it almost on 80,000 patients, these things, in the last months in trials. And they tested 16 years and above. And they didn't have people who have cancer, who are on chemotherapy, children, or pregnant women. Having said that, it is both vaccines are 95% effective, Ravi. They are very effective. I'm not in the front line, as I said. So I went to register myself to get an appointment. And they said, not many people showed up on day 1. Do you want to get it? I said, sure, why not? So that's the reason I got the vaccine yesterday. Otherwise, I would have gotten it next week. So the vaccine is very effective. The vaccine is very safe. So on the 80,000 patients that were tested in the trials, um, long term, we do not know, but we don't anticipate that doesn't stay in the body. It just creates antibody. So how long will it be? Will we be immune? It could be several months. That, like flu vaccine was several months, and we need to give it every year, right, Ravi? So the efficacy rate is much more than a flu vaccine. It is 95%, and it's quite safe. Nobody had any serious adverse effects. It requires 2 doses. The first dose is given, and then the second dose is given in either 3 to 4 weeks. If it's Pfizer vaccine, it's 3 weeks. If it's Moderna vaccine, it's 4 weeks. After the first shot, you start getting a good protection, and you can see decreased number of vaccinated people get infections by 10 days. And you're almost at 50% safe. After the second shot, a week after the second shot, you get the full immunity. The side effects are usually after the second shot. They're usually mild, but there could be pain in the arm, pain in the body, flu-like symptoms, little fever. You could feel fatigued. You could have, various symptoms, headache. But severe symptoms or moderate symptoms occur in a small percentage, maybe 15, 20%, and they usually last only a day or two.
Got it. Got it. Yeah.
So when you have the symptoms, side effects, that means the vaccine is working.
Yep. So Ravi, you want to maybe just address that question of when the general public are likely to get, how long you think it will be, and
Yes, that's $1 million question. My Lekha wrote to me saying, "When is mom getting it?" Soon after I sent a picture home about me getting the vaccine. I think it will be several months, Ravi, because you realize about 40 million vaccines will be available this month, because Moderna is also shipped already and it's been approved. As a physician in our organization, we got about 3,400 shots. Um, so our frontliners are 5,000. So more will be coming. So they're giving it to the people who are in the hospitals, and then people who work in the offices will get next. Having said that, next month, it all depends on how many vaccines are approved. So if it's just 2 vaccines, next month there will be another 50 million more, or 60 million, depending on how many they can produce. But 60 different companies are trying to get into this market. The UK one, AstraZeneca, Oxford one, looks to be very effective as well. That vaccine is created by attenuated virus. It's not mRNA vaccine. So they take the virus, inactivate it. That's why flu vaccines have been done. So that's effective as well. So we don't know when that will be approved. So the more we get, more people. So the first in line will be the healthcare frontliners, then the vulnerable people, elderly, nursing home patients, people with illnesses. Then the more healthy you are, like you'll be later part of the total, maybe April, May.
Right.
Oh,
Yeah.
one thing, Ravi, let me talk about the vaccine. So I got the vaccine. That means, can I not spread it to you if we were to meet? So that we do not know. I could still be carrying the virus in my nose, and there may not be immunity in the mucosa, because antibodies are in the bloodstream, right, in the body. So I might still harbor the virus if I get infected. So I could still spread it. So even though one gets a vaccine and they are immune to it, we still need to follow these precautions, wearing a mask, distancing and all, till the virus becomes almost, there's 70% herd immunity, maybe
Right.
till summer.
Right. Okay, so Ravi, actually, I see many questions coming, and as usual, it's very exciting to actually see many questions. And also, there's even the format on how we are doing. Also, there are a few questions, but I just want to first quickly address. I know Subha had a question. Why don't we do a structure presentation followed by Subha? The point is, like, there's a whole deck. You will get the access to deck. You will get the whole thing. But here is more of interactional. That's what many people have asked. So that's why we wanted to just kind of do interactional. So some of the known standard questions is what I'm asking, and then in about a few minutes we will actually start jumping onto the Q&A of people actually sending them. So that's the reason. I know it could be done both ways. So Ravi, one more maybe just two more follow-up questions, and then we'll jump onto everyone what they're asking. So in the meantime, those of us who have not taken the flu shot, should we take the flu shot? I mean, is there? I know there's probably no correlation to vaccine and the flu shot, but is it important that we take the flu shot?
Ravi, this is such an important question, and this is a question we physicians, including myself, have asked the experts. And I have taken the flu shot about 3 months ago, and I keep texting my family. I think Sravani got it, but I am not sure about Lekha yet. And Dakshin got it after me persist. It's very, very, very important we take the flu shot. And in our organization, if we can get 50% of our patients vaccinated, we get an award. Forget about 100%. Knowing well it works, it's been there for decades. Flu vaccine works, uh, but majority don't take it. There's a lot of myths, misconceptions, and fake media going around. Flu shot is extremely important to take. Please take it. I encourage everyone to take it. People who are allergic to eggs can take it. People who are pregnant can take it. Kids can take it. Older people can take it. Really, there's no contraindication. Taking the flu vaccine will, Ravi, about 400,000 to 500,000 people get flu requiring hospitalization in this country.
Wow.
Not a small number.
That's
And almost 20 to 40,000 people die every year from flu. So it is important to take the flu vaccine. And there's one study from Brazil that showed if you take the flu vaccine, your mortality from COVID could be less.
wow.
So it might have some benefit, that's debatable, but flu vaccine is a must. And if any of you got COVID already, you can still take the COVID vaccine, and must, because the immunity by the vaccine is a lot more potent and longer than the immunity you get by getting the COVID infection. We are not doing it for ourselves. We are doing it for the society.
Correct.
We are doing it for the global prevention of spread, and encourage it. When you get the vaccine, take a picture and share it with the people who are naysayers. The people who don't want to wear the mask, there are certain people in the same group who don't want to take vaccines. They're spreading all these things. The same people who said vaccinations cause autism. There is no scientists in those debates. It's Tucker Carlson's, those kind of people doing harm to this world.
Yeah, yeah. So, like in part of the structured questions, next two, and then we'll jump on to lots of interesting questions coming in. So, Ravi, the question is, okay, given all this is happening, what precautions do we take? Particularly given this is a holiday period, obviously we all want to meet families. Temple has some very powerful prayer activities happening, particularly, around the Janmashtami and the Vaikuntha Ekadashi, etc. So if we were to go to a temple, what precautions do we take? If you're meeting with the families, should we meet? If so, what precautions should we take?
So, Ravi, where are you right now?
I'm, I'm the cheater here. I'm in Tampa, Florida. Yes, I'm with my daughter.
No, you didn't cheat, Ravi.
Just
You
kidding.
took expert advice and you followed the precautions. And could you share how you traveled, Ravi?
Very much so. No, so this was a big question actually because I was debating a great deal, and Ravi coached me. He said it's not worth staying home all the time because there is also a downside to that. If you have a family and if you're limiting yourself to your immediate family, I came here to visit my daughter, basically my wife Indra and I. And but when we are coming in, we did three things. One, we had our standard. N95 mask. On top of N95, I put in the regular mask, which I think all of us wear this one. And then on top of it, I also put a face shield. And we ensured that at the airport, wherever we are going, we're trying to cut down as many touch points as possible. So at the airport, we were actually staying a little far away, etc. It worked like magic. It was fantastic. And our commitment is we're not going to go freak out in any tourist destinations, etc. We'll stay home. At best, go for walks. The beautiful river walks around here. That's what I did.
All I say, Ravi, is don't listen to the governor of Florida.
I will not. Okay. But
So,
what's
Ravi, if 95% of the people wear masks, we can decrease the number of deaths by 130,000 less deaths by February. That is how serious this is. So if we don't need to congregate, If we don't need to be in public places, we shouldn't be. It is very serious matter because once you get it, you either get better after the second week or you get sicker. And if you are in that 15-20% requiring hospitalization, 10%, there are no beds in the hospitals. It's very tight fit. So it's not for me and you, right, Ravi? We don't want that somehow to spread to a vulnerable patient, elderly person, or somebody with illnesses. So it is very, very important we wear masks and we follow the guidelines of physical distancing. And if we are meeting, like me, my sister Vidya's family, we both families we meet for, fairly often. So we are 8 of us with 3 dogs. We keep the room ventilated. We try to meet outside if we can, stay outside, and have lot of breeze going. So the gets diluted. And if somebody were going out like Leka to Los Angeles and back, she should wear a mask sitting with us. But I think we need to wear the mask, except while eating or drinking. That would be ideal. And when we sing, when we talk loudly, we throw the virus 8 to 10 feet. And that virus can stay in the air for many, many minutes. So we used to think it was just droplet. Maybe there's also airborne with the way it's so contagious. So I could go over the guidelines that we went over the slide as to the things, precautions. We all know what to do, really.
Okay, so the last question again, this whole hoarding thing is coming back. Do we need to again, this is your guideline, do we need to really go get some extra medical supplies? Do we need to go get this extra paper towels, etc. supplies? What's the balance that we need to really take?
So Ravi, for the guys who don't follow the rules, they probably should get a pulse ox, uh, which checks the oxygen. But for the people who are careful, like you and majority others, um, you won't get it. It has to go through your nose and mouth and sometimes through the eyes. So if you protect it yourself from getting it, then you won't get sick, right, Ravi? It has to get into your body. So having said that, this hoarding thing, like all the toilet papers are sold. Why toilet paper of all the things, right? Right now, Costco doesn't carry the charming soft one. The people are buying, so they limited it. So there's no rationale behind it. It's out of fear.
Yes.
There's no point hoarding. The food is not going anywhere. In fact, you can order it, they'll come and deliver it. It's ridiculous to hoard anything. My own classmates, Ravi, they went and got hydroxychloroquine from India when I was saying it doesn't work, let's wait for studies. They depleted the hydroxychloroquine from the people who actually need it, like lupus patients, rheumatoid arthritis patients. These are physicians, few of them, out of fear.
Yeah, absolutely. Well, thank you so much. So we're actually, as planned, we are 30 minutes into the webinar. We'll take the next 25 minutes. But very interesting questions came, Ravi. Lots of questions. So, please. And what I'll do is I'll try to ask them in the sequence in which they've come. That way it will become easy for me to...
Let me have a disclaimer, Ravi. First of all, I'm not an expert. So I'm here just to clarify all the nonsense going on in the media.
Yes.
From a physician perspective, right? So if I do not know the answer, I'll make sure I'll get the answer from the experts and get back to them on email or whatever.
Thank you. And also many are asking if they can get access to your PowerPoint deck. I answered saying yes. And also, obviously, we will share the webinar. So that's always standard. It will come in a two days from now. From the webinar itself, you will get the actual recording. Okay, the first question we are going, during unavoidable circumstances of people who need to report to work, where there are colleagues from different communities who doesn't take virus seriously and mix with their friends during weekend or work in same place, how can one protect without being out of place in their work environment? I'm not naming the names of the people who asked, but yeah.
So believe it or not, there's one of my colleagues in another institution doesn't think the masks do a whole lot initially. So this is a sad state of affairs. But honestly, it doesn't matter if your colleague is wearing it or not. What matters is you wearing it. That way you don't get it. A N95 protects 95% of the particles entering your nose, right? So a regular mask will probably protect 50, 60. I don't know. It's N50 and 60. And putting a handkerchief is not that good. Maybe it's better than nothing. So if you are at work with people who are not believing in physical distancing, which I doubt, they must be really dumb not to know that there are actually COVID cases going around and hospitals are full, is maintain the distance and talk, do not talk loudly. If you need to have a meeting, do it like this and have it ventilated in case. So when we have to meet in the cat lab, we all are wearing masks all the time and we maintain distance as much as possible. Where it is spreading in places is we relax with family, right, Ravi? You're not wearing a mask in front of Kavita and Dipyun. And we also relax with friends. We just somehow assume that they don't have it. So when we meet, we increase the possibility of transmission because most of the transmission is from asymptomatic people. 48 hours before they get the symptoms is the maximum transmission. So, Ravi, does it answer your question? I'm giving long-winded answers.
No, I think that was a question that came from one of the Q&A side, but I think it answered. Basically, they're saying if I'm at work where other people are not following, basically what I'm hearing from you is, observe some precautionary measures and a lot of apply as they say in the campuses, apply common sense when it comes to activities that kind of come about.
So, Ravi, I'll tell you what I do. I wear a mask. I go into work. And it's not just wearing a mask, how it is fit on you, because you can wear an N95 and it's on your mouth.
Yeah.
It is N0.
Yes.
Or N20. I mean, it's still going through the nose. So you need to wear it, and then how to don it and doff it is also important. You don't want to touch the outside because that's where the virus is. So handling it, the surfaces, cleaning the surfaces, washing the hands very frequently. So when you're flying in the plane, in the airport, if you need to, my sister Vidya is going to India. So what I would suggest if she's going to seek my advice, which is if you can touch things, you can touch the rails, you can touch anything, but before you touch your food and touch your face, wash your hands. And you can't wash your hands in the airport all the time. So just carry a wipe or a hand sanitizer, and keep the fan going. The air in the aeroplane is circulated 30 to 40 times a minute. So it's very unlikely that we get it, even if somebody were to be sick, if we protect ourselves. So if you wear a mask, it will protect. But if there's a likelihood this guy is putting out droplets, I think if you're exposed to blood or procedures, is wear a face mask on top of face shield on top of the mask. Mask is a mandatory.
Face mask, I recommend face mask to everybody. It's amazing what power it can bring.
130,000 deaths we can stop by February if 95% of us in the US follow it.
Absolutely. Okay, the next question is a science question, Ravi. How does mRNA compare with vaccine of AstraZeneca?
So there's no comparative studies. It's not even out there, where each vaccine is studied by itself with placebo. So no two vaccines are done comparative studies in a randomized case controlled double-blind study. So I think they're all effective, at least these three. I don't know about the Sputnik vaccine or something from Russia. I have no idea. There's something from China. I haven't seen any data. I do not know. But if you get a vaccine, either Moderna, Pfizer, anything approved by the FDA in this country, I would take it. I would jump it and take it. It's in your best interest.
Very nice. Okay, continuing on. Is the vaccine safe for teenagers? Is vaccine safe for someone with peanut allergy?
Yeah, there are no peanuts in there. There used to be egg product in the live attenuated vaccines from the flu when they were made. There's no, even people with egg allergies can take it. No, there's no peanut, there's no nut products. Somebody with polyethylene glycol, like the PEG, if they're allergic to that, they just talk to the physician. We'll learn more. I'm a guy, you can see me how I'm doing. I didn't have any side effects. I felt the needle. It's easy to give a needle to somebody else than get it yourself, but um, it is such a tiny needle. I didn't even feel it, and the amount of zero point 0.3 ml. That's all there is. So it is a little sore, but I really, because you're asking, I can tell. I haven't had any symptoms, but with the second one, you can get it. So everybody should get it. Young, once they are in line for it, obviously. Uh, Pregnant women, cancer patients, immunosuppressed patients, they all should get it. If they have a question, they just talk to them. By the time, we'll have a lot more experience.
I mean, just as a matter of data point, my daughter as well as Deep, son-in-law, both of them also got the shot, no side effect. They got about 3 days back. Yeah. Okay, continuing on. So many people are appreciating, Ravi, what you're doing. So there's some comments. I'm not going to read all the comments, but there's a lot of appreciation for what you do. What's the reason for giving 2 shots?
Um, so basically, you get full immunity after the second shot, a week after the second shot. So I got my first shot yesterday. The second shot for me is January 8th. And a week after that, so 3 weeks to 4 weeks between the first shots for the antibody levels to develop. You need to have a certain level to have immunity. So a week after the second shot, Ravi, which is, so it is 4 weeks from now, I'll have 95% chance of not getting it.
Got it. I think you answered it, but I'm just going to read this again. The vaccine stops the spread. Does the vaccine stop the spread?
So the way it's vaccine does is you have less number of people getting really sick, right, Ravi? So you don't take up the hospital beds, you don't take up hospital visits or clinic visits, testing and all that stuff. So it is, they still need to practice wearing a mask. So there's a potential that we can still spread the virus, because the virus in the nose may not get killed by the antibodies in our bloodstream. That is a possibility.
Right, right, right.
So it won't stop the spread. We just need to cut down the number of cases. So 70% of the population should get immunity to get herd immunity.
Got it, got it. One more question on allergies, but you answered that one. So there's another one I see. Any data on side effects or the long-term effects on the vaccine?
So there, because it's a mRNA vaccine, it's in the body for a short time. It's not going to provide immunity a year later. But now the whole infrastructure that's been developed since the Ebola virus, MERS virus, they thought this will attack the whole world. They already prepared, but because there's no money, it costs billions of dollars, right? So it was halted, but they again ramped it up. So next time there's a pandemic, we'll be a lot faster than this. The side effects long term are very unlikely. That's what the experts feel, because it's mRNA, or even flu vaccine. We've been getting it for how many years, right? There's no long-term effects
Yeah, yeah.
expected.
No, thank you. And great thing about our community is a lot of people are well read. Of course, some of them go into like a lot of science aspect here. So here is one person's question: is there was a peer reviewed paper presentation, like materials like zinc reduces the side ill effects of COVID. Can you share any perspective on it?
Yeah, they talked about zinc, vitamin D, and so many other things. There's no evidence to suggest they make any difference.
Got it. Got it. Okay.
I think the best thing, Ravi, we always talk about good health of the physical, mental, mind, attitude, sleeping well, go out there, get exercise. Because we have become more sedentary, we need to be careful, because sedentariness in the world is killing 5.6 million people a year, more than smoking. So we need to be physically active 45 minutes a day. We need to eat like our grandparents in villages, sattvic diet, more plant-based, sleep well, and the end is near. So we have to have good attitude, confidence on this.
Actually, I like that one. I think that mental
So
health
good health is the best protection against this till we get the vaccine and beyond it.
Yeah, no, absolutely. So in these testing times, kids are feeling alone with restricted play. What precautions can be taken when they're playing within the community, like using common playground area, etc.?
It's a tough one. If they can play wearing a mask, I think that if the kids are explained, this is a risk that you might bring it to me or your grandparent at home, is in open air, the virus is very dilute, Ravi. So playing in open air than in a closed room is always better, and less number of the kids better. And if they can wear a mask and play and then wash their hands afterwards, that will be wonderful. But I think they should be out, they should be physically active. There's a lot of spike in mental illnesses in young adults due to this pandemic that is not recognized, and the suicide rates are also going up. So this has to be taken seriously, that they need to stay socially engaged.
Yeah, yeah, wonderful. So the other one is, I guess, is a directional question. Besides the vaccine, can we expect a direct oral medication for some whatever the symptomatic treatment?
Symptoms, yeah, symptoms with COVID, there's no medicine to directly kill the virus, right? The study with remdesivir, which is antiviral agent, uh, initially there was a lot of enthusiasm. What it is we give it to hospitalized patients, and it didn't show that it decreases death. It only decreases on days in hospital. So the things that seem to be working are steroids in hospitalized patient with decreased oxygen to decrease the inflammatory cytokine storm. It is given decadron 6 milligrams a day for 10 days, typically in the study from England called Recovery. But some people are taking to extremes in Andhra Pradesh, giving high doses, 10 to 20 times the dose for longer periods of time. And I've seen deaths from secondary infections by overdoing such things out of fear or their own judgment. So there's no drug to kill the virus. There's drug to support the reaction of our body against it, the cytokine storm. You give oxygen, you give high flow oxygen or ventilators, remdesivir to decrease hospitalization. The antiviral, other things haven't shown to decrease death either. The antibody cocktail that Donald Trump and Rudy Giuliani got, the jury is out there. I don't know if it decreases mortality, it probably decreases hospitalization. So they are not widely available, but we are getting the vaccine sooner than those things, So in the next 6 months, I think by summer, we'll see by end of 2020, we'll go back to the more normal.
Thank you, thank you. So one of this is an interesting question. Actually, I didn't hear. It's a good learning on this one. Apparently, one of our community member, their pediatrician informed them the kids in the age bracket of 4 to 12, there is no vaccine yet for the kids. So can you advise when kids in age bracket 4 to 12 so-called vaccine be available?
That I don't know, Ravi. I think the experts will decide depending on the number of companies are approved, number of vaccinations available. They're the last of the people to be vaccinated if it's still going around. However, as you know, there have been very rare case reports of severe inflammation of the blood vessels in children, causing a lot of inflammation of the aorta, of the arteries, including the heart. But if you look at all the people that died in the United States, 1.67 million people died, right? In the world, and the 314,000 died in the US. That age group kids are not even point some percent. The mortality is extremely rare. The chance of they getting very sick is extremely rare.
Yeah, yeah.
So their need is less and towards, and by the time pediatric group of the country, the experts will come with recommendations and what to do with vaccine. I don't know.
Got it. Well, Ravi, you're very popular, so more and more questions coming. So let me just keep shooting.
I think the COVID is popular, not me, and I don't know if I have all the answers.
But
Not
I think
popular, it is a crowd.
I meant, people respect your actually viewpoint and perspective. You're very practical to me for sure. Okay, here is a question. As mRNA vaccine is a chemical rather than the virus itself, does it have any possibility of reacting on other parts of the body, such as blood, etc.?
It hasn't shown to do any harm in several months. The
Yeah.
whole thing is only, the data is 8 months, 9 months, right? Since the vaccine, not even that long, I think. Um, and now I think UK got vaccination before us. We started getting vaccinations now. So millions of people will get it just this month. So
Yeah.
we'll have more data as you all will get the vaccine. We are all kind of the frontline vaccine people. So it is shown to be very safe. The real experts of this don't think the mRNA will have any long-term consequences. It won't be in the body even.
So Ravi, I don't know if you saw, there was a, maybe I shared this with you. There was a link that came from New York Times wherein actually they ask you about state of your health, age, etc. And then you pump in, they show where you are in the entire US in the line and where you are in California, where you're in Orange County or in even your city. They kind of give you the queue. And I was like somewhere like 830,000. So when it comes to city and the entire country, I'm somewhere like 78 million in the line. Is that dependable? Is that just for fun? I
So
mean,
it
if
is depending on their expectations of the vaccines available, right, Ravi? So
yeah,
once more are available, it will be faster.
okay. But what I'll do is I'll share that
Share
link.
that thing. I did it myself too in that one. Yeah.
Yeah, it's a fun actually. It was very well done link, and I'll send it to everybody.
Ravi, New York Times has a very good, in addition to CDC, WHO, other good websites, or Harvard, or even our organization. And CNN, Sanjay Gupta, Anderson Cooper with Anthony Fauci, they do a town hall. It is very enlightening because they get really good experts on those.
Nice, nice, absolutely. So here is maybe related question. When do you, rather, how do you plan when partial members of family staying together are vaccinated? I mean, meaning some are vaccinated, some are not. How do you plan? I guess probably the same precautions apply, right? The mask, etc.
So you are better off than now, isn't it? At least some people are protected. But uh, if all of us are careful and not exposed, so we can't spread it to each other. The question is whether we'll get it from somewhere else. So the person going out the most, but we don't get to choose. We get based on our age and other, right? Comorbid conditions. If we have blood pressure, obesity, diabetes, we go up in the line.
Yeah, absolutely. So deliberately, I kind of kept all the travel related questions somewhat together because I rather read those 4 or 5 questions that came. And I know you partially addressed, but it still will be useful. Can my mother, who is visiting on visitor's visa, can qualify to get vaccine? She's 69 years old. There are many like that. Let me just pick another one. Is my son, daughter coming home from East Coast? Should we quarantine and physical distance with the child for any period of time? There are related travel related precautions to be taken. Can you touch upon the broader aspect? Because there's so many questions, so I'm just trying to combine them together.
So right now, Ravi, the vaccine is completely free. The US government, and I think worldwide, I don't think anybody is paying for the vaccine itself. It is the administrative costs, right? So when the vaccine is limited, you choose who gets first, like what we are doing now, frontliners, healthcare workers, like that. But once vaccines are available abundantly, they'll give it to anybody, right? So and it's good business, right? The Target or CVS will say, "Oh, come for $25 or $100," like flu vaccine. So anybody can get it eventually. But in terms of how do they know somebody is a resident, green card holder? I don't know who those kind of criteria have not been
Right.
uh, given out yet.
Basically, you recommend taking it like, that's what.
Without a question, Ravi, there's really not even a discussion in terms of it is extremely important we take it. Uh,
That's right.
and especially people who are not healthy, who are on the heavy side, who have blood pressure, diabetes, they should take it. They should talk to their doctor. I think they could order it. I don't know how it works, the distribution.
Right, right.
Right
So
now, the way it is, Ravi, the federal government sent it to the state sent it to the county, and the county health distributed based on the number of healthcare workers in each of the organization. They distributed to Kaiser Permanente, St. Joseph's, things like that. St. Joseph's have taken Madhvi Mumaneni, my colleague. She's a cancer specialist. They have given her a date in January with Moderna vaccine, even before it was approved, because they were pretty sure it will be approved and the stocks are coming. So yes, talk to the physician, primary care, and they'll help about those parents getting it.
Got it. Got it. I mean, I'll probably just take a few more, and I do want to be respectful. I know we always try to start on time, close on time kind of story. So maybe another 4, 5 questions, and then we can just close on this one. And any of you have additional questions, what we can do is Ravi is always happy to answer them. I'm actually speaking on behalf of Dr. Ravi Janjala. He'll be very, very happy. He's always been supportive. Any questions, just maybe shoot him an email or a text message or so. If there's something that he hasn't answered, he will answer. Alternately, you can send it to this web to us. We can put them all together as a summary line for Ravi, and he can actually answer. We can again share that via email, so-called WhatsApp. So Ravi, here are a few questions. If you need to go to dentist or eye checkup, should we postpone it? I noticed the staff are not using face shield. Should I skip my next visit? So it's like a general directional question again.
So if the staffer is not wearing a face shield, it is risk for that person. It's not risk for you, because eyes don't, your eyes are not transmitting the virus, your nose and mouth. So if the staffer is wearing a mask, it doesn't, so that will reduce it. But what you need to do is you are protected. So if there's any fluid likely to be and they're getting too close, you should wear a mask and face shield. And with the dentist, how do we do that, right? So if they're wearing it, then they can't spread it to us. If the room is well ventilated, they can't spread it. If something can wait for some time, because even those people in the dental field, eye field will be getting this vaccination because they are healthcare providers. So let them get vaccinated. That doesn't mean they can't spread it, but at least the number of cases will go down and slowly, we get more and more immunity. Anything you can avoid, postpone it. If you have to go for it, wear a mask. And if there's some fluids that can fall in the eye, wear a face shield. It's a badge of honor to wear those things, We can't be shy.
Yeah, thank you. And here is, I know you answered, but there's a kind of, I don't know if it's a little counter, but maybe a clarification question that came on the flu. When with all the social distancing and precautions that we are taking, where is the risk of getting the flu? Does the flu travel through the air? So I want to just probably add the question, which is, you still recommend taking a flu shot, right? I'm adding my question there.
So the flu will be a lot less this year. That's a very good point, because of the social distancing. In fact, when we do a patient in my particular field, there is me, my technician, the patient, and the 2 nurses. So we are 4 people in addition to the patient in the room. 4 of us with the patient, 5 of us. So we are very in close contact with the patient, right? I don't see as much sniffles and cough and cold in my department. People calling in sick with the usual viruses around this time of the year, because we are all wearing masks. So what I think is, if any one of us has a cough or cold in the house, we should wear a mask so we don't give it to others. That will help decrease the spread for other viruses as well.
Got it. Okay, so another question, Ravi. Given that multiple vaccines are going to be coming soon, hopefully by the time we all are ready for the rest of us. So who decides which vaccine do we get, and is there a choice?
I would get the first available vaccine, because they will be FDA approved, right? So they are safe.
Okay.
So these are taken very seriously, Ravi. They don't take it lightly. They have been looking at the data very, very with a, and then we would have had 3-4 months of experience with people like me and many others, of millions of healthcare workers. And not all are in the best of health, right? We have health workers who have heart attacks, who have had cancer, doctors who have had cancer, doctors who have had bypass surgery. They all receiving this vaccine. Then so much more data will be available worldwide. I would take the first available vaccine. I don't know when there will be a time where we'll have so many vaccines that we can actually pick and choose. That will be probably
Yeah, right.
after
Thank you.
April.
So, no, with that bright note and with that optimistic closing, Ravi, thank you very much again. As ever, I can't tell you bottom of our heart. We're always thank you for the service and the seva that you do. And I want to actually thank Sharmagaru also because that's the seva that he's doing. He always felt there is obviously a spiritual angle to it, but there's also a community angle. So what we are doing, while obviously we can go to the temple, pray to God for everything that we want to pray, but there's also a different kind of prayer, which is really people like Ravi or Venkat on business, there are a couple of other people who are actually supporting the cause of this for the community welfare, if you will. So that's why we started this webinar series, what we call as expert series. So watch out for the next webinar. Particularly Ravi mentioned about the mental health. I mean, there is an angle of people not feeling good, feeling down about it. So we want to really bring in an expert who can say what you can possibly do to be just calm, to be simple, to be cool about things while all medicinal things are going. And there are also, we bring in spiritual masters. So there is a potential for us to get some Swamijis also to kind of communicate this one. So Sharmaji is actually working on those as well. So we will have a many more as time goes by, and that's this expert web series. And thank you again. Sharmagar, do you have any comments, closing comments? But thank you everybody again. We'll take all the questions. We'll share this document. We'll share the deck as well. Sharmagar, for your closing comment.
Sarmagaru, can I say one closing remark?
Please,
Sorry
please,
about
sir. Please.
as Ravi was speaking, some ideas came. We are all individuals and we think about us, our family, our parents, our children, but we are part of the bigger society. We are only as good as the society. And a community organization that gives us spiritual strength, mental strength, like SivaKameswari temple, we have to support it. Those of us that salaries have not been, or we still are financially stable, it is imperative on us to support such institutions. There is so many people waiting in lines to get food, especially during this holiday season. We should use such excellent centers, the community center that Sharmagaru, with support of people like Ravi Renduchintala and many others, Subbarao Garu, and many Akellas, Ram Batlas. There's so many of people supporting the temple. We have to do some food drives, Ravi, and community activities where temple also benefits. We need to financially support it. You did a beautiful drive with thanking Tuesday, or Tuesday thank. So we are doing this masking and all for the society. Same thing, we have to support such institutions. And if we were to go to the temple, and we should keep the distance and follow the rules Sharmagaru devises based on California guidelines. Thank you, Sharmagaru, for doing such activity, and more strength to you and the organization.
Thank you, Andy. And so temple is we have a mask compulsory if anybody visits, but as Vaikuntha Ekadashi is coming up, and first of January is coming up, we already in the website, everything is placed in place where you can sign up online archanas. You don't need to come to temple. You can stay at your home and demand any archana, puja, and darshan also by appointment. And if you would like to come to temple, you have to make an appointment and call us, so that way we can give that appointment when not many people are there, one-to-one only. So we are taking all precautions. Stay at home and safe, and please watch all the pujas online, and avail all the archanas and everything online also. Thank you very much. Thank you, Ravi Garu. And thank you, Ravi Garu. Ravi Garu both. Ravi Dvayam.
No, thank you. I actually just I normally don't want to stretch it, but looks like we haven't answered this one question, Ravi, which is the kids coming from East Coast. Do they need to follow the quarantine? Just can you just kind of give a one quick line on it, and they can have that person ask call you as well.
So if you are healthy, you are young, and you are not likely to spread it to other people, that there's a grandmother at home or somebody unhealthy at home, you could be a little lax. Ideally, you shouldn't be. Than if somebody's who's unhealthy is at home, right? And who are these kids? Are they your own kids or somebody else's kids? I'm assuming your own college kids. And it depends on how well they were careful. So until proven otherwise, everybody is a suspect. You need to think about everybody's carrying it, because asymptomatic carrier is very real, and it's the way it is spreading. We have 250,000 new cases just yesterday, 3,000 deaths yesterday. So this is a very serious, very extremely contagious disease. We need to take all the precautions possible. So if they're coming and you are at potential risk of getting very sick with it, keep the distance, keep the rooms ventilated, and if you're sitting close, wear a mask. And yes, you should take precautions, and quarantine is a good idea.
Wonderful. Wonderful. Thank you very much. Thanks, everybody. Namaste. Thank you. We'll follow through.
Ravi, I'm sorry. All these questions that people have, they can go to CDC. There's so many websites. The very good answers are available. In fact, sometimes I go there and look at it because of, and in anticipation of a question, how to answer. All these are available online from good websites.
Yeah, no, it's a good point. Very good point. Thank you. Wonderful. Thank you very much. Namaste all, and have a wonderful time. Happy holidays.
Happy holidays. Stay healthy, stay safe,
Thank you.
and see you soon.